Good morning. I remain Dr. Anastomosis physiotherapist. Today we are going to demonstrate Bobath Hemirrhab stage 2. In that kind of case, you meet the patient in the normal position that we taught the patient how to stay in the spine line position. That's what we have discussed in our last video. So if you meet the patient in this proper positioning, it's expected that the muscle powers is up to 2 or 1 plus. That's Oxford muscle grading. It's either modified Oxford muscle grading, maybe 1 plus or 2 plus, or even 3 depending. So in this kind of case, we are now going to educate the patient on how to sit, auto-assisted active movement, from lying to sideline, from sideline to sitting, from sitting to standing, from standing to walking around the bed, from moving around the bed to maybe just like bridging in the bed to bridging, all this exercise and other exercises, maybe walking on a parallel bar using a biofeedback like Miro as one of the biofeedback mechanism and other things for Bobath too. Then what we are going to do now, so in that case, we'll first of all do the auto-assisted. Put your hand like no, face up. Put your finger, good, side, good. Encourage the patient to raise it up. Good. If you get to this level, tell the patient to bring it down. Good. That's one. Raise it up. Try. Good. Bring it back. Good. The essence of stabilizing the elbow joint is to prevent elbow flexion of the affected hand. Raise it up, bring it down. 2. Applying a gradual movement at the shoulder joint to improve the range of motion without exacerbating pain at the joint. You bring it back. 3. Raise it up, bring it back. 5. Raise it up, then you get to the edge, you bring it back. 6. Then when you have taught the patient how to do this, the patient can now do it on his own, on her own. Put your hand, raise it up on your own. Good. Take it down, 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 down. Good. Bring it back. That's good. You see, the patient can perform it after assisting the patient to do it. This is auto-assisted, using the unaffected hand to hold the affected hand so I can be able to raise it to the required range. The next thing is you tell the patient to flex the hand, move it forward, face forward, face back, face forward, face back. So when you have assisted the patient to do it, you tell the patient to do it on her own. Do it. Face forward, face back, face forward, face back. The essence of this is to improve pronation and spination of the forearm. And the next thing you will do, you tell the patient, put your finger, push it to this side, push it to this side, push it to this side, push it to this side. Then you encourage the patient, but do it on your own. Good. This is to improve wrist extensors, to improve the range of motion of the wrist joint, so the patient can now perform it on her own. The next thing we are going to do is bridging. The essence of bridging is to strengthen the trunk muscles and the lower muscles. Majorly is the lower limbs muscles are going to strengthen. Then as the patient has put the leg, try to separate the 2 legs to improve balance. When you have put the 2 legs apart, then the next thing you tell the patient to raise the hip up. Then you want to bring it down gradually, raise it up, bring it down, good, raise it up. You count 1, 2, 3, 4, 5. Bring it down, good. So far the patient can do it. Then we improve the weight bearing by carrying the unaffected leg and place it to the affected leg, lower limbs. Then we tell the patient to raise it up, good, get down, raise it up, You count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Tell the patient to drop. So the essence of this exercise is to improve weight bearing on the trunk, on the lower limbs, and equally strengthen the trunk muscle so that the patient can sit without support, or equally stand without support. Then when you do this exercise, you remove the leg, then you apply a little resistance. Tell the patient stretch, because it's assumed that this patient can extend the leg without on a gravity-free plane. The patient can extend the leg on a gravity-free plane. In this kind of situation, you want to apply a little resistance. So far, we are trying to train the patient on how to walk, how to sit and stand. So there will be a kind of strengthening so that the patient can be able to perform those activities. You stretch your leg, you apply a little resistance. Say good. Okay, you bend your leg and strike it again. Bend it. So in that kind of case, you can still tell the patient, you can strap the leg of the patient just to reduce excess load. Then the leg will be hanging. Okay, we are going to strengthen the lower muscles, that is resisted active exercises for the lower limbs. Tell the patient to bend your leg, bend your knee. Good, you try to resist it. Stretch. Good. Say bend. So you can see the power of this knee is up to 3. So stretch of the lower limb is up to 3. Good. Another thing you can do to reduce load for yourself is that you can strap this leg. This thing is elastic in nature. Then you tell the patient to bend your leg. Good. Stretch. Don't allow your leg to hang. Bend again. Good. Whenever she's bending, she's strengthening the hamstring muscles. Then she stretch. You can bend again, bend it. Let's count. 1, 2, 3, 4, 5. Say stretch. Then as the leg is hanging, they have to pull down. As she's pulling down, she's strengthening the quadricep muscles. So that's another means of strengthening the lower limbs with a little workload for the physiotherapist. Then the next thing we're supposed to do after this is a sideline position. Tell the patient shift inside. So you tell the patient to turn. First of all, bend this leg straight this way. Okay. Then we are going to put a little sideline. If you want to move a patient to sideline position, you don't need to drag the trunk or the upper back. First of all, bend the knee, then turn the neck. Other body will follow. Then the patient will move the trunk towards the affected side. Then this is sideline. Then you tell the patient to face up again. Stretch. This is the affected side, so she's going to turn towards at the side of the affected side. This is the affected side. So you tell the patient, bend your knee. One. Move. Bring your hand. Good. She have turned to the affected side. This is sideline. From sideline, then you tell the patient, bring your leg down. Shift towards. Then you tell the patient, push this bed. Apply weight on this side. That's it. Good. This is sitting from spine line to sideline, from sideline to sitting position. So the patient can still lie down. Patient wants to lie down, she will bring this hand forward, then bring this hand gradually. She will lie on the sideline position. In this position, then you do weight bearing on the affected hand. You put the hand this way, get the patient to remain this position for like some minutes. You stabilize the shoulder joint so that it will not fall back or forward. You stabilize. Then that's for weight bearing. You can equally improve the weight bearing on the upper leg here and stabilize the elbow joint. You stabilize the elbow joint for weight bearing on the lower limbs. Then for like 5 minutes or 15 minutes or 3 minutes, depending on your patient, then you will come up to sitting. Then the next thing we are going to do is standing. So standing, or we talk about transfer. We teach patients how to move from bed to seat, because in standing the height of the bed might be very high, like this bed. Then in placing of the bed for sideline, for lying from high sitting on bed, this is high sitting because the leg is not touching the ground, it's not touching the floor, it's not touching the floor. So this is high sitting. So you can now tell the patient to sit on the bed. The patient will first of all, if the bed has an armrest, she will hold the armrest. But so far as not having the armrest, she will shift. Having without this hand, we shift. Good, shift. Then you support the patient to stand, to sitting, normal sitting posture. In this normal sitting posture, you as a physiotherapist have to first of all demonstrate the patient on how to stand without support. Where the first one you have to assist. First of all, you tell the patient, put your arm together. The essence of telling the patient to put his or her arms together, fingers together, is to bring the body's center of gravity in the center of the body, so that the patient will not fall to the right or to the left while trying to stand. Now, the second thing, you as a physiotherapist, like, I'm going to tap the two legs so that I can be able to feel the ground and be able to grip the floor while standing. This stroke patient has this fear of fall, so there is any possibility of the patient looking down stiffly. That is not a problem, as we are going to use parallel bar with parallel feedback to correct this abnormality. Tell the patient to push forward, push back. You see what I'm doing? Push forward, push back. Then you tell the patient not to relax on the seat. Let her come a little bit out. Push forward, push back. Push forward again, push back. The third one, let the patient try to lift her buttocks out from the seat, and she will sit back. Try it again and sit back. The third one, she can now be up to standing. Well, let's do it. As we're doing, the physiotherapist has to sit at the affected side. Affect in case of if the patient wants to fall. Okay, now push forward, come back, one, forward again, come back, two, forward, the last one, come back. And if you are moving forward, try to lift your hip out of the seat. Good. Come back. Try again. Good. Stand up. Try to stand. You put hand in the front. The patient will stand. This is for standing training. Then for sitting, as the patient is standing like this, then there are two methods. In sitting, we needed something that a seat that have a backrest and armrest. In that sitting posture, you can tell the patient, try to make sure that your leg touches the seat before you will sit down. Then the unaffected hand should actually touch the armrest before she should sit. If her leg is touching the seat, it gives her the confidence that the seat is at her back. If her hand is touching the armrest, the unaffected one, she has the courage that she cannot fall. So it's a kind of gaining more coordination and balancing while sitting, so that she will not fall to the affected side. Then stand again. Pupil forward, she can now do it because she did it for the first time, so she can do it. The next one is that you need to move this leg forward, bring it back, forward, bring it back, put it down like that. We'll move this unaffected side forward, bring it back, forward, bring it back. Let's hold, lift this leg up a little bit off of the ground. Good, drop it. Wow. Lift it up, drop it. When a patient is doing this kind of movement, you try as much as you can to stay at the affected side so that she will not fall while performing this activity. So far the patient can do it. Now we start by walking around the bed. So far she's holding this thing together, she's holding hands together. Definitely she's not going to fall, as she's going to control herself using the two hands. Walking around the bed. Good. Then she turns towards the affected side, so that the affected side will bear the body weight. Then walk. Good. Good. That's the training on the training around the bed. This was. So we are going to train her. It's also part of the Bobath Hemirrhab stage 2. We're going to train her on the parallel bar. Possibly from here, we can now win her out of the parallel bar, fully walking around the space without use of maybe walking stick or any other thing. Or maybe if we need any other support, maybe like a walking stick or any other thing that's just for minimal support. Then first of all, it's assumed that the right side of the body is the paralyzed part of the body. And now, first, what are we going to do? First of all, we carry the hand back, lift your hand up, and place it on the bar. Yes, she might not get that firm grip on the parallel bar, but she has to place the hand first. Even though it's an affected side, you can hold it with your hand. Then you tell her to put this one, tell her to stand. That's good. Tell her to sit. Tell her to stand. Tell her to sit. Then tell her to raise the affected leg up. Sit, drop, up, drop. Raise it up like this. Drop, up, drop. So the muscle power is up to power 3. So we can actually ambulate this patient. First of all, let's stand up. Then encourage the patient to move. Then remove the hand. Good. That's the training on the parallel bar. Try to encourage the patient to look at the mirror so that I can watch her posture if there's any abnormality. Then she will turn to the unaffected. She will turn to the unaffected. Then transfer the affected side. Good. That's the ambulation training on the parallel bar. Good. So far she can walk, holding herself on the parallel bar. The next thing for her now to transfer. Good. Put the other hand up. Now we encourage the patient to remove hand from the affected side, unaffected side, and put it down and try to walk, managing the affected. Good. Put your hand in the front and the back in case of fall. Good. When she wants to turn, let her turn to unaffected side. Unaffected body side, yes. Good. Encourage ambulatory training. Good. Then the next thing is that you train the patient not to hold anything. You put your hand on the chest, then get the patient to hold her two hands together. Then let her walk. Good. Let her turn. Good. So these are the training on a Hemirrhab valve. The next training now will be on a bicycle ergometer.